Hey, future nurses, Dr. Mike here, and I'm pumped to help you crush the NCLEX-RN. Now I know from experience that spinal cord injuries can feel intimidating, but trust me, once you break it down, it's totally manageable. Think about it. Understanding SCIs is about connecting the dots. You've got the anatomy of the spinal cord, the mechanics of the injury, and then the nursing care that directly relates to all of that. So in this video, we're going to simplify everything about spinal cord injuries, from the different types and causes to the essential nursing interventions. Let's make sure you're totally prepped to ace those NCLEX questions. Alright, let's start with the basics. Imagine the spinal cord as this superhighway of nerves running down your back, sending signals between your brain and the rest of your body. Now, a spinal cord injury, or SCI, is like a traffic jam on that highway. It's a disruption of those nerve signals usually caused by trauma, but also things like tumors or infections. This disruption can lead to problems with movement, sensation, and even organ function below the level of the injury. Think about it. If the signals can't get through, the body can't respond the way it should. And remember, SCIs can be complete, meaning total loss of function, or incomplete, meaning there's some function left. Now, most SCIs happen because of trauma, like car accidents, falls, or sports injuries. Picture the force involved in those situations. It can seriously damage the spinal cord. But it's not always about high-impact trauma. SCIs can also be caused by things like tumors pressing on the spinal cord, infections causing inflammation, degenerative diseases like arthritis, or even problems with blood flow to the spinal cord. It's all about understanding how these different factors can disrupt that crucial nerve communication. Here's where things get really important for your NCLEX. Understanding the level of injury and how it impacts a patient's function. Think of the spinal cord like a ladder. The higher the injury on that ladder, the more of the body is affected. For example, an injury to the cervical spine, up high in the neck, C1, C4, can mean trouble breathing and often requires a ventilator. Remember the saying, C3, 4, 5 keeps the diaphragm alive. An injury lower down, like in the thoracic spine, T1, T12, might mean paraplegia, which is paralysis below the waist. Knowing these levels is key to providing the right care. Now, spinal cord injuries aren't one-size-fits-all. There are different syndromes or patterns of injury that can affect what patients experience. For instance, anterior cord syndrome is like losing the front side of that nerve highway. You lose pain and temperature sensation below the injury, along with motor function. Then you've got central cord syndrome, which is more common in older adults where the arms are affected more than the legs. And Brown-Sequard syndrome, that's like having damage on one side of the spinal cord, leading to weakness or paralysis on one side and loss of sensation on the other. It's all about those specific nerve pathways. Okay, so you walk into a patient's room. How do you know if they might have a spinal cord injury? Well, first look for the obvious. Any loss of movement or sensation below a certain point in their body. Also, check for things like pain or tenderness along the spine, changes in breathing, problems with bladder or bowel control, and any signs of shock. Remember, a spinal cord injury is a serious medical emergency, so early recognition is key. In an emergency situation, your priority is to stabilize the spine. Think of it like this: you don't want to make the injury worse by moving them incorrectly, so keep that spine immobilized. Next, focus on the ABCs: airway, breathing, and circulation. Make sure they're breathing okay, their heart rate and blood pressure are stable, and be ready to intervene if needed. Remember, time is of the essence with spinal cord injuries. Once things are stable, remember the acronym SPINAL to guide your nursing care. S is for securing the airway. These patients might need help breathing. P is for preventing pressure ulcers, because they can't feel when they've been in one position too long. I is for immobilizing that spine. N is for neurological checks to monitor their function. A is for watching out for autonomic dysreflexia. We'll get to that in a bit. And L is for lung hygiene to prevent pneumonia. Speaking of autonomic dysreflexia, this is a life-threatening complication that can happen with SCIs, especially at or above T6. It's like the body's alarm system goes haywire, causing a sudden spike in blood pressure. Think severe headache, sweating, and a slow heart rate. Other complications to watch out for include spinal shock, which is a temporary loss of reflexes below the injury, and neurogenic shock, which affects blood vessel tone and can lead to dangerously low blood pressure. Alright, future nurses, let's wrap this up with some NCLEX-style wisdom. First off, always prioritize spinal stabilization in trauma. You'll see this concept over and over again. Remember that sudden high blood pressure with a pounding headache and slow heart rate screams autonomic dysreflexia, and if you've got a patient with a cervical injury, always assess their breathing first. That's it for our rapid review of spinal cord injuries. Remember, understanding the mechanisms, assessments, and nursing care is key to feeling confident on your NCLEX. Now, I know you might be feeling overwhelmed with all this info, but trust me, you got this. Just break it down step by step, practice those NCLEX questions, and you'll be well on your way to becoming an amazing nurse. Don't forget to smash that like button if you found this helpful, subscribe for more NCLEX study tips, and hit the notification bell so you don't miss any future videos. Keep up the amazing work, and I'll see you in the next one.